Good morning, everyone. Okay, this is just a quick video before I go on shift again this morning. Yesterday's shift, I was doing a 10 till 8:30 in the evening on the patient service vehicle. So it was like a backup vehicle for the front line. So it was a frontline vehicle, but it's double manned by ECAs. So we had two ECAs on the vehicle, which we can do emergency sort of Cat 1, Cat 2, Cat 3s if we wanted to, if they needed to. Most of the calls yesterday, in fact, thinking about it, all the calls yesterday, we had like 4 calls, but they were long ones. They were either to be transferred from one hospital to another, or they were transferred from home into care or home into hospital. The first chap I had was quite an overweight gentleman. We think he had some kind of mental block, or there's a problem there because in the home he wasn't very happy. They weren't very happy with him. Quite slurred speech, which happened over the last couple of days. So it sounded more like neurology, or it could have been something else, a bit more sinister as well. So basically we had to take this gentleman to hospital to have him looked over, and then he would be then reassigned to another abode at the time, because he was a little bit on the combative side. Whether that was to do with the neurology in his head, we don't know, but our job was to extricate him from his present location to hospital to have him sorted out. But yeah, he was quite an interesting gentleman, and you'll find there's lots of stories when you're at the back of the ambulance and talking to your patients. Some of the stories that come out with it are sometimes quite sad and sometimes quite funny. Yeah, that was quite good. The other ones were basically cancer patients, which was quite sad. So I had a gentleman which I had to take to a hospice because he was on his end of life care, and he was just a frail old gentleman, and obviously his wife has done what she could do, but she was actually elderly herself and she couldn't take care of him. So it was quite a sad story there. He had all his faculties about him, but he couldn't speak very well. He looked very, very poorly. And when someone's that poorly, you try to keep your face bright and happy for them, and for the family. And the story on this one is that he used to be a dancer, this chap. And as I was helping him out of his bed and holding him up to be able to then put him into the carry chair, he gave me a wink and a little sort of cheeky grin. And I said, "You think you're going to be dancing with me?" And he sort of vocalised yes, because he couldn't speak very well. And I was just holding him, but he was a bit cheeky. He was in his 90s, bless him. But you get patients like that as well. So they know their end of life, and for all the pain they go through and all the upset of getting to the place where they are currently, and they know they're going to be going to a hospice, or they'll never see their own bedrooms again. That's really hard. And this chap had a little glint in his eye still, so I knew he was in there still. And his wife said, "Sure, he's never winked at another lady in all these years." So he all quietly. I won't tell my husband that though. Okay, so that was that one. And then the last one we went to was a lady about my age, and she had breast cancer, and it just spread all over her body in the last couple of weeks, months, I suppose. And she was very poorly, and her parents were there. And so I think, as a mum myself, to see your own children, for them to go before you, that must be the most heart-wrenching thing. I never would have wished it on myself or anybody else. I could see the pain in the parents' eyes. They were elderly parents, and they're basically sending their child to. We went to the Macmillan's Centre, and she had declined quite drastically in the last sort of 48 hours. So it was, thinking this is probably the last time we will ever see her again. But she tried to keep her spirits up as well. She was trying to joke a little bit about, how she used to do adventures and things like that, and how she tried to change her wigs around to make sure that's the right size and the right colour for her face and things like that. And yeah, it was really heartwarming to think that she still had so much life in her, that she wanted to explore life, but sadly it's not going to happen. And she wasn't a DNR either. It wasn't a do not resuscitate patient. She wanted to be resuscitated if she was going to go, if her body was failing. She wanted CPR, which is great because that means she's a fighter. Through all the pain she's going through and how cancer has actually wrecked her body so badly, she's still fighting, and she was one of the most bravest people are cancer people, because they're living with this horrible disease that anyone can get at any age, any walks of life. It's not discriminate against anything, and she's just trying her best to beat it. Bless her. So it was quite a oh, sorry. So yesterday was quite a hard, emotional journey, taking these patients back and forth to their locations. It wasn't hard in the way of actually working wise. It was just the emotional wise, because I don't know about you guys, but I've lost members of my family through to cancer, and quite recently too, and it's been really hard to go back to certain homes and certain hospitals where my family members and friends have been, that I've had to leave there and then come back and realise they've gone. So the thing with this job is that you're a human being, and on the outside you have to keep bright and happy, or try to show. You can show sadness, but you have to show them in the way of, if you're feeling for them, but you've also got to show that you're here to help them professionally as well. And after leaving those patients, if you want to have a little cry or talk to your colleague, or that's the best thing really, because that means you can then leave it at work. The worst thing about, if you come across something which is quite upsetting, like my cardiac arrest chap the other day I was talking about, if I'd taken that home and pondered on it, I would make myself sick and I'll feel awful. But I was warned about this sort of thing in training, and the best thing to do is try and talk it out with people at work. They've also got these volunteers and these groups that you can actually talk to help overcome upsetting situations that, just sometimes people don't get upset by, what one person might say, oh, that didn't really upset me because I had no experience in my own family or friends of cancer. But then there's other people who've had experience of that, and it affects them. So different things affect different people. But what I'm saying is there's always help there if you need to download your feelings, because the worst thing is to keep it inside. One of the paramedics I spoke to, he's been on the force. He's been in the NHS for about 20 years. He used to take all his problems home. He used to take the worries of, did he do the right job? And he took the worries about how the patient is, things like that, what people said to him, when they were under the influence of alcohol, which they obviously didn't mean to. And it got to the point where he was starting to become depressed. Okay, and that's something we can't have. We can't have make ourselves ill inside, because if we make ourselves ill inside, we can't help anybody else. Okay. In my past, I had suffered from depression, so I know how difficult it is to get out of that dark place. So to try and find some way of getting out of there is, for me, I didn't think it was going to work. It was talking to people and just releasing all this upset within inside me, and then trying to find a way to fix the problem. Okay, because sometimes it's environmental. It could be money, it could be stress at work, it could be anything like that, or it could be a medical problem. Whatever it is, it needs to be tackled, and then the depression will then get sort of looked after and maintained, and then hopefully get going again. But yeah, that was my lowdown from yesterday. We finished on time, sort of 8:30 in the evening, which is quite nice. And my lovely husband decided to cook me some dinner last night. What you find is that when you're on the road, having lunch or dinner, you can't do it at the right time. Trying to make sure that you can eat something a bit more healthy. Saying that, I had a packet of crisps yesterday, so I can't, I can't teach people that. But yeah, it was very emotive yesterday. So I've got now another half an hour to go before I leave. I'm going to grab some food, and hopefully if I've got time I shall do another video on this today's shift, and let's see what happens. Okay, take care of everyone, be safe, and I shall talk to you soon. Bye bye.